At the Valley Cancer Institute in Los Angeles, California, radiation oncologist Dr. Haim Beecher uses microwave and ultrasound to heat tumors. According to Beecher, tumors are more easily damaged by heat than normal tissue, making radiation and chemotherapy even more effective.
If you give half the dose of radiation and hyperthermia, you will accomplish the same result as a full dose of radiation, or even better. Both the cancer cells and the cancer blood supply is very susceptible to heat. A tumor is not a normal organ. It's constantly fighting for its own life.
Beecher points out that hyperthermia alone is not enough to kill a tumor. It simply enhances the power of other treatments. And it has less toxic side effects than chemotherapy and high-dose radiation.
You don't make the patient sick with the treatment. For its limited use, can be a tremendous help.
Ivy chose hyperthermia because the side effects are less severe than with high-dose radiation and chemotherapy. She's been a patient here for 4 months.
Okay, Ivy, now we're going to insert the microthermocouple into the breast tissues. You know you have the catheter in there.
Okay.
So as we go in, you won't feel anything, but the thermocouple will be positioned inside of your tumor.
Okay. The reason I chose this method is because it's non-invasive. There's no chemical going to my body. Basically just using heat to kill the bad cells, which, you know, I find it fascinating.
Her treatment consists of daily visits to the clinic, where she receives a combination of low-dose radiation and heat therapy. Dr. Beecher begins each treatment by placing a small sensor into the tumor to regulate the heat. Temperatures can rise as high as 117 degrees. If the heat becomes too much, there's a bell nearby for Ivy to ring.
She will feel warmed, but she will not feel pain. If she feels pain, she has to immediately press this and will lower the power. Doesn't matter what the thermocouple is, the best thermometer.
Next, he applies heat through this microwave applicator, regulated by a nearby computer.
Okay, Ivy, you're all set now. So now just relax and do what you always do. Go to sleep.
Thanks. It feels like it as if you're getting a suntan. That's exactly what it feels like. And most of the time I just go to sleep, because that's how comfortable it is.
Carla Sweeney was also diagnosed with stage 3 breast cancer, and like Ivy, she chose hyperthermia as part of her treatment.
And it was going into the chest wall, and the people there said, the doctor said that when it enters the chest wall, you lose a certain protection that the body has, a natural protection, and it can metastasize much easier, so that's when we decided to come and do the hyperthermia.
After 4 months of treatments, Carla's cancer went into remission.
We have the latest results from the MRIs that were done, and you can see this was your tumor when we started. Remember, it was attached to a chest wall here.
Yes, it was close to the wall, yeah.
And this is your breast now. It's a normal breast. There's no evidence of anything there.
I'm grateful that there was something like hyperthermia that I could do rather than the chemo and high-dose radiation.
But Carla must be diligent. Dr. Beecher warns her to get regular exams to make sure the cancer has not returned.
Remember, you have to do this now every 3 months.
Okay.
Myself or an oncologist.
Have a picture taken every 3 months. You find yourself very grateful for those moments of just being with your family, doing the dishes, being together.
Ivy's tumor is shrinking. It's now 1/3 of its original size, and today her prognosis looks good.
When Ivy came to us, the breast was almost totally replaced by tumor. You see the tumor begins to disappear. And as this happens, she's reassured. You cannot imagine how happy that person is at that point.
Hyperthermia is one of many new approaches now being used to treat cancer. But the next big breakthrough